Alright, hi everyone. My name is Emily Taplin, and today I will be presenting to you on sickle cell anemia. So first off, what is sickle cell anemia? So sickle cell anemia is an inherited disorder that affects hemoglobin, which is a molecule within red blood cells that attaches to oxygen and helps carry it throughout the rest of the body. So next to that one point, I have a picture of hemoglobin. It has 2 beta and 2 alpha subunits, and we'll discuss this later in the video why that's important. So in sickle cell anemia, red blood cells can become sticky, rigid, and they're shaped in the form of a crescent. So due to that, they can get stuck within blood vessels, blocking the blood flow, or even stopping the blood flow throughout the rest of the body. Here I'm going to compare a normal red blood cell versus a sickle red blood cell. So normally your blood cells are disc-shaped, they're soft, and they flow easily throughout the blood vessels, and they normally live for about 120 days. A sickle cell is sickle-shaped. It can be hard and sticky, and due to that it can often get stuck in small blood vessels, blocking that blood flow throughout the rest of the body. And they normally live for about 20 days or less. Here I have a picture of normal red blood cells within a blood vessel, and then comparing it to sickle red blood cells in a blood vessel. So as you can see, the normal red blood cells are flowing very easily throughout the blood vessel, versus sickle cells are all getting kind of clumped up and stuck and blocking the blood flow. So next we're going to discuss the symptoms of sickle red blood cell, or sickle cell disease, excuse me. So sickle cell disease is present at birth. However, most infants don't show any signs or symptoms until about 4 months old. These symptoms are caused by mainly not enough healthy red blood cells bringing enough adequate oxygen throughout the rest of the body. So that causes fatigue and shortness of breath. So there may be yellowing of the eyes or of the skin, which is also known as jaundice. Due to the red blood cells getting stuck in the blood vessels, this can not have enough adequate blood flow to the organs, so that can in turn cause organ damage, especially in lungs, kidneys, spleen, and the brain. So those are all very severe. Another severe symptom of sickle cell anemia is pulmonary hypertension, which is also known as high blood pressure. So next we'll discuss the molecular cause of sickle cell anemia. So as we saw on one of the slides earlier, hemoglobin consists of 4 protein subunits, the 2 alpha and a 2 beta globin. So a normal hemoglobin beta gene provides instructions for making beta globin. So within sickle cell disease, at least one of the 2 abnormal genes causes a person's body to make what's called hemoglobin S. So sickle cell anemia occurs when there are 2 hemoglobin S genes. This is caused by a point mutation found on chromosome 11, and hemoglobin S replaces both beta globin subunits. Glutamic acid is replaced with valine at the 6th position. And because of all this, the hemoglobin S subunits will stick together and form that crescent shape that causes the not enough adequate blood flow throughout the body. So prevalence. Where is sickle cell anemia most common? So we know that one of the most common blood disorders in the United States is sickle cell anemia. However, it's most common in Africa, Saudi Arabia, India, the Mediterranean countries, and Spanish-speaking regions within the Western Hemisphere. So because of where sickle cell disease is most prevalent, we can find that malaria is also prevalent in that area. So there's a correlation between sickle cell disease and malaria. So on a positive note, individuals who are carriers for the sickle cell disease, they have a protective advantage or a survival advantage against malaria. Due to this, the frequencies of sickle cell carriers are higher in the malaria endemic areas. Sickle cell trait causes fewer deaths in areas where malaria is most prevalent. And here I have a picture of Africa. So you can see on the left where the sickle cell allele or sickle cell disease is most common there. And then you can compare that to where malaria is most common as well. They kind of correlate together. So next we're going to discuss the mode of inheritance for sickle cell anemia. So sickle cell anemia is inherited in an autosomal recessive pattern, meaning that both copies of the gene in each cell need to have the mutation. Parents of an individual with the autosomal recessive condition each carry one copy of the mutation, but they typically don't show any signs or symptoms because it's a recessive pattern. If an individual receives one gene for sickle cell disease and one normal gene, they will have a condition that's called sickle cell trait, but again, they won't show any signs or symptoms unless they have both copies of the mutation. So next I'm going to show you a pedigree that kind of illustrates how sickle cell disease is portrayed throughout a family. So those with blue in the corner have the sickle cell disease. So we can look specifically at Dave and Mary and their side of the pedigree. We can see that Dave and Mary do not have sickle cell disease. However, they do have a child that has the disease, Jordan. This is a common factor in a recessive disease where two normal parents will have an affected child. We can also go through the pedigree and look at the different alleles for each individual and examine that those who have a big A and a little a are going to be those that carry the gene for sickle cell disease but don't show any signs or symptoms. So if two individuals with both big A and little a, such as Dave and Mary, have a child like Jordan, the chances of them having a child with the disease are 25%. The chances of them having a normal child are 25% as well, and then the chance of their child having a sickle cell trait is 50%. So they won't show any signs or symptoms, but they will carry one of the genes. So next we're going to talk about genetic testing for sickle cell disease. So there are a few different tests that we can do for sickle cell disease. First off, there is an option for newborn screening. So actually beginning in 1990, infants that were born in U.S. hospitals had to be tested for sickle cell disease, and so still today there is routinely testing in more than 40 states for sickle cell disease. In the newborn test, we can do a diagnostic test, which is a blood test that can show whether you have a sickle cell trait or the sickle cell disease. Later on, in adults, a blood test can be drawn from an arm, a vein within the arm. So another option for genetic testing is amniocentesis, which is a test that can be done in the 14th and 20th week of pregnancy. It's a prenatal test that tests abnormalities in a small amount of the amniotic fluid sampled from the amniotic sac that surrounds the fetus. Another prenatal test is chronic villus sampling, which can be done during the 10th and 12th week of pregnancy. These involve sampling the placental tissue and testing it for abnormalities. So both amniocentesis and chronic villus sampling can determine if an unborn baby has sickle cell disease or if it's a carrier for the gene. Another option is pre-implantation. So that tests embryos for the defective gene prior to implantation. Parents can then determine whether or not they want to keep the embryo or not. In any of these, early detection is extremely important due to the many factors that can be caused because of sickle cell disease. So if early detection is found, they can start diagnosis and treatments right away, avoiding those complications later on in life. So how do you manage sickle cell disease? So unfortunately, currently there is no cure for sickle cell disease. However, there is a stem cell transplant that could be done, but it's the only potential cure, and it's not 100%. So treatments such as medication and blood transfusions are aimed to relieve pain and prevent those complications later on down the road. And finally, a very important aspect for those with sickle cell disease is to live a healthy lifestyle, as we all should. And that's it. Thank you. Congratulations on being finished with phonetics.